What if your kidneys were quietly struggling, and you had no idea? What if the early signs were so mild that you blamed them on aging, stress, or lack of sleep? For many adults over 55, kidney disease develops slowly, without dramatic warning. Most people associate serious illness with pain. They expect sharp discomfort, strong symptoms, or obvious physical decline. But kidney disease often behaves differently. It can progress quietly in the background, while daily life feels completely normal. Your kidneys are two small, bean-shaped organs located just below your rib cage, toward your back. Though small in size, they perform essential functions that keep your entire body balanced and stable. Every day, your kidneys filter approximately 50 gallons of blood. They remove waste products, regulate fluid levels, balance electrolytes like sodium and potassium, and help maintain stable blood pressure. They also activate vitamin D for bone health and produce hormones that stimulate red blood cell production. In other words, healthy kidneys support your heart, your bones, your brain, and your overall energy levels. After age 55, natural aging begins to reduce kidney filtration capacity slightly. This does not automatically mean disease. However, it does mean the kidneys become more vulnerable to stress and damage over time. Globally, chronic kidney disease affects a significant portion of older adults. Many people do not realize they have it until routine blood tests reveal declining kidney function. High blood pressure and diabetes are the two leading causes of kidney damage worldwide. Both conditions become more common after age 55, which increases overall risk. The early stages of kidney disease often produce mild or vague symptoms. Because those symptoms can overlap with normal aging, they are frequently dismissed. In this video, we will walk through early kidney disease warning signs that many adults over 55 ignore. We will explain why they occur, why they are overlooked, and what you can do to protect your kidney health. As we age, blood vessels throughout the body gradually lose flexibility. This includes the tiny blood vessels inside the kidneys that are responsible for filtering waste from the bloodstream. Each kidney contains about 1 million microscopic filtering units called nephrons. These structures depend on consistent, healthy blood flow to function properly. When blood pressure remains elevated over time, it increases pressure inside these delicate filtering units. This constant strain can slowly damage the nephrons. Diabetes adds another layer of risk. Persistently high blood sugar levels can damage small blood vessels throughout the body, including those in the kidneys. Over time, damaged nephrons lose their ability to filter waste efficiently. As fewer units function properly, the kidneys must work harder to maintain balance. Certain medications, especially when used frequently for chronic pain, can place additional strain on kidney function. Long-term overuse of some pain relievers has been linked to kidney injury in susceptible individuals. Dehydration is often underestimated. When fluid intake is consistently low, kidney filtration becomes more concentrated, which can stress the system. Heart health and kidney health are closely connected. If the heart struggles to pump efficiently, blood flow to the kidneys may decrease, affecting filtration capacity. Smoking, obesity, and high cholesterol also contribute to vascular damage. Because kidneys rely heavily on healthy blood vessels, any condition affecting circulation can influence kidney performance. The encouraging news is that early detection can significantly slow progression. Many cases of early kidney disease are manageable when identified before severe damage occurs. One of the earliest and most commonly ignored signs of kidney disease is persistent fatigue. This is not ordinary tiredness after a busy day. It is a lingering sense of low energy that does not improve significantly with rest. Healthy kidneys help stimulate red blood cell production through a hormone called erythropoietin. When kidney function declines, this hormone production can decrease. Fewer red blood cells mean less oxygen delivered to tissues throughout the body. This can create feelings of weakness, sluggishness, and difficulty maintaining normal stamina. Many adults over 55 assume fatigue is simply part of aging. While energy levels may naturally shift with time, persistent or worsening exhaustion deserves medical evaluation. If fatigue appears alongside other subtle symptoms, such as swelling or changes in urination, it becomes more important to investigate kidney health. Another early sign of kidney strain is swelling, particularly in the lower legs, ankles, feet, or even hands. This swelling may be mild at first and develop gradually. When kidneys cannot remove excess fluid efficiently, fluid begins to accumulate in the body's tissues. Gravity often causes this fluid to settle in the lower extremities. You may notice socks leaving deeper marks around your ankles, or shoes feeling tighter than usual by the end of the day. Swelling can also be linked to heart conditions or prolonged sitting. However, when persistent and unexplained, kidney function should be assessed. Early fluid retention is often subtle, which is why it is frequently dismissed or attributed to normal aging. Because kidneys are directly responsible for producing urine, changes in urination patterns can signal underlying problems. You may notice increased frequency at night, reduced urine output, or difficulty urinating. Some individuals report darker urine or a change in odor. In early kidney disease, these changes are often mild and inconsistent. That inconsistency makes them easy to overlook. Frequent nighttime urination can also be linked to prostate enlargement or bladder issues. Still, kidney function should not be ruled out without testing. Monitoring patterns over time provides more insight than focusing on a single day's change. Foamy or unusually bubbly urine may indicate the presence of excess protein in the urine, a condition known as proteinuria. Healthy kidneys normally prevent large amounts of protein from leaking into urine. When the filtering units become damaged, protein can escape. Occasional bubbles in urine are common and usually harmless. However, persistent foam that resembles soap suds can warrant evaluation. Protein in the urine is often one of the earliest measurable signs of kidney damage. A simple urine test performed during routine screening can detect this change early. When kidney filtration declines, waste products can gradually build up in the bloodstream. This accumulation may affect cognitive clarity. Some individuals describe difficulty concentrating, slower thinking, or mild confusion. Because stress, poor sleep, and aging also affect focus, mental fog is rarely immediately associated with kidney health. However, when cognitive changes accompany fatigue and other physical symptoms, it may signal a deeper imbalance. Early testing can determine whether kidney function is contributing to these subtle mental changes. Persistent dry or itchy skin can sometimes reflect imbalances in minerals and waste products regulated by the kidneys. Healthy kidneys maintain balanced levels of calcium, phosphorus, and other essential substances. When this balance shifts, skin symptoms may develop. While dry skin is common in older adults, unusual itching without visible rash may warrant discussion with a healthcare provider. Skin changes are often overlooked because they seem unrelated to internal organs. Yet the skin can sometimes reflect deeper systemic issues, including kidney dysfunction. Persistent puffiness around the eyes, especially in the morning, may signal fluid retention or protein leakage. When protein escapes into urine due to kidney damage, fluid can shift into surrounding tissues. This can create subtle swelling around the eyelids that many people mistake for poor sleep. Occasional puffiness is common. However, recurring swelling combined with foamy urine may indicate kidney involvement. Again, early urine testing can help clarify whether this symptom is related to kidney function. Frequent muscle cramps, particularly in the legs at night, may be associated with electrolyte imbalances. Kidneys regulate minerals such as sodium, potassium, and calcium. When these levels shift, muscle function can be affected. Cramps may feel sudden, painful, and disruptive to sleep. Dehydration can also cause cramping, which is why hydration habits should always be evaluated. When cramps occur alongside other subtle symptoms like swelling or fatigue, kidney health should be considered. One of the reasons early kidney disease goes unnoticed is that the symptoms are often mild. They do not interrupt daily life dramatically, which makes them easy to dismiss. Fatigue can be blamed on aging. Swelling may be attributed to long hours of standing. Nighttime urination might be assumed to be a normal part of getting older. Because these symptoms overlap with common age-related changes, many adults delay seeking evaluation. Another reason kidney disease is overlooked is the lack of pain. Many serious conditions cause discomfort that forces attention. Early kidney damage rarely does. Busy lifestyles also contribute. Even after retirement, responsibilities, family obligations, and daily routines often take priority over preventive medical testing. Some adults avoid lab testing because they feel well. It is natural to assume that feeling normal means everything is functioning properly. Unfortunately, kidney disease can progress silently for years before noticeable symptoms appear. By the time severe symptoms develop, kidney function may already be significantly reduced. This is why awareness of subtle early signs is so important. Recognizing small changes allows for earlier testing and intervention. The goal is not anxiety. It is informed vigilance. Paying attention to patterns rather than isolated symptoms can make a meaningful difference. The good news is that kidney function can be evaluated with simple, widely available medical tests. A blood test measuring creatinine levels helps estimate how well your kidneys are filtering waste. This estimate is often reported as eGFR, or estimated glomerular filtration rate. The eGFR value gives healthcare providers an indication of kidney filtration efficiency. Lower numbers may suggest reduced kidney function. A urine test can detect protein leakage. The presence of excess protein in urine is often one of the earliest measurable signs of kidney damage. These tests are routine and often included in annual physical examinations for adults over 55. Blood pressure measurement is also essential, as uncontrolled hypertension remains a leading cause of kidney damage. For individuals with diabetes, monitoring blood sugar levels carefully is equally important in protecting kidney health. In many cases, early kidney disease is identified through routine screening rather than symptom-driven visits. This reinforces the importance of regular checkups, even when you feel well. Early detection often allows for lifestyle adjustments and medical management that can significantly slow disease progression. Protecting your kidneys begins with controlling blood pressure. Maintaining healthy blood pressure reduces stress on the delicate filtering units. Managing blood sugar levels is equally critical for those with diabetes or prediabetes. Stable glucose levels help prevent damage to small blood vessels. Reducing sodium intake can support both blood pressure control and kidney health. Many processed foods contain hidden salt that adds up quickly. Staying adequately hydrated supports proper filtration. Drinking sufficient water throughout the day helps kidneys remove waste efficiently. Maintaining a healthy weight reduces strain on the cardiovascular system and kidneys alike. Regular physical activity improves circulation, supports heart health, and contributes to stable blood pressure. Avoiding excessive use of over-the-counter pain medications, unless directed by a physician, may help protect kidney function over time. Quitting smoking, if applicable, improves overall vascular health and reduces risk of kidney damage. Scheduling annual physical examinations ensures that changes in kidney function are detected early. Small, consistent lifestyle choices often have a powerful cumulative effect over time. Kidney disease after 55 is not inevitable. Many adults maintain healthy kidney function well into later decades of life. The key is awareness, routine monitoring, and early action when subtle changes appear. If you recognize persistent fatigue, swelling, foamy urine, changes in urination, itching, puffiness, cramps, or mental fog, consider discussing these symptoms with your healthcare provider. Early evaluation does not mean bad news. Often, it simply provides clarity and direction. Understanding your kidney health empowers you to protect your heart, brain, and overall vitality. If you found this information helpful, consider subscribing to the Vital Age Clinic for more evidence-based guidance designed specifically for adults over 55. Your health journey does not end at 55. With knowledge and proactive care, you can age with strength, clarity, and confidence.